Have you ever felt your heart suddenly racing, even though you were just sitting quietly in your favorite chair? Or maybe you've stood up a little too quickly, and the room spun longer than you expected. What if these moments weren't random at all but small whispers from your heart, calling out for attention? Hi, I'm Dr. Nana, and in this video, we're going to talk about something most people never see coming: the earliest signs of heart failure. Here's the surprising truth. Heart failure doesn't always storm into your life with a dramatic heart attack or a frantic rush to the emergency room. In fact, it often begins quietly with little signals that are easy to miss or easy to dismiss. And that's exactly why this conversation matters. Spotting those early, silent clues could make all the difference between protecting your health and facing something serious down the road. I'm not here to bury you in medical jargon or overwhelm you with frightening statistics. Think of this as a calm, honest talk, just you and me, about what your body may be trying to tell you. Because when it comes to your heart, ignoring the little things often leads to bigger consequences. So, let me ask you, are you ready to listen closely to what your heart may be saying? If you are, drop a 1 in the comments. If you're not sure yet, that's okay, just hit O. And don't forget to subscribe to Senior Health Boost, where we share clear, life-saving tips to help you live stronger and age better. Now, let's look at the very first clue that often slips under the radar. When your heart begins to struggle, it doesn't always cry out in pain. Sometimes it simply speeds up like an exhausted worker trying desperately to make up for lost time. That's why a fast resting heart rate can be one of the earliest signs of heart failure. Normally, when you're relaxed, your heart should beat steadily, around 60 to 100 times per minute. But when the heart grows weak, it has to pump harder just to push blood through your body even when you're doing absolutely nothing. That's when you might suddenly feel your chest pounding, fluttering, or racing without any reason at all. Some people describe it as a sudden thump-thump that catches them off guard, even while watching TV or reading a book. And here's the part too many ignore. This isn't just a passing sensation. Over time, this constant extra effort wears the heart down even more. According to the American Heart Association, a consistently high resting heart rate is linked to earlier onset of heart failure and higher risks of complications. If this sounds familiar, don't brush it off. Start by keeping a simple log of your heart rate, especially when you're at rest. These days, you don't need special equipment. A basic wrist monitor will do, and many smartphones can measure it too. If you notice your resting heart rate is regularly above 100 beats per minute, bring it up with your doctor. It's such a small step, but it could make a life-changing difference. Now, let's move to another early warning sign, one that many people mistake for just getting older or simply being tired. Have you ever walked into a room and suddenly forgotten why you were there? Or maybe you've struggled to follow a conversation or lost focus while reading the newspaper. So many people chalk this up to aging. But sometimes it's actually your heart sending signals through your brain. When your heart isn't pumping efficiently, less oxygen-rich blood reaches your brain. And since your brain depends on a steady supply of oxygen to stay sharp, you may start to feel foggy, forgetful, or lose track of your thoughts. This isn't simply absent-mindedness, it's a warning sign. In fact, research published in the Journal of the American College of Cardiology shows that even early heart failure is often tied to cognitive decline. Everyday lapses like misplaced keys, drifting focus, or feeling mentally off can reflect reduced blood flow to the brain. If that sounds familiar, try to notice when it happens. Do you feel it more after physical exertion, like climbing stairs? Or later in the day when you're fatigued? Keeping track of patterns can help your doctor see the link. This isn't meant to alarm you, but to help you catch the issue early when you can still protect both your memory and your heart. And now, let's look at another signal. One that doesn't show up in your chest or your head, but instead appears in your legs as the day winds down. By evening, do you ever notice that your socks leave deep marks around your ankles? Or that your shoes feel tighter, even though they fit comfortably in the morning? That swelling in your feet, ankles, or lower legs could be an early sign that your heart is struggling. Here's why. When the heart can't pump efficiently, blood starts to back up in the veins. That pressure pushes fluid into the surrounding tissues. That's why swelling often appears in both legs, getting worse as the day goes on. It's not just tired feet, it's poor circulation. Doctors call this condition peripheral edema, and it's one of the red flags for heart failure. The National Heart, Lung, and Blood Institute warns that fluid buildup in the lower body is a common signal that the heart is under strain. You can even test this at home. Press your thumb firmly on your shin. If a dent remains afterward, mention it to your doctor. And if the swelling comes with weight gain or shortness of breath, don't ignore it. Your legs may be quietly telling the story of what's happening in your chest. The earlier you listen, the easier it is to ease the burden on your heart. So, now that we've covered racing heartbeats, brain fog, and swelling legs, let's move forward. Because there's another subtle sign one many people dismiss as nothing more than fatigue that could be your heart's next warning cry. In the first part, we looked at some subtle but powerful signs your heart may be sending: racing beats, foggy thoughts, and swelling legs. Each one, though easy to dismiss, can be an early clue that your heart is struggling. Now, let's continue by looking at several more signals that often slip under the radar but carry just as much weight. Let's start with dizziness, those sudden spells when the world tilts, even though you're doing something simple. Have you ever stood up quickly and felt lightheaded, like the floor shifted beneath you? Or maybe you've had moments when you nearly fainted during an everyday activity. These aren't just quirks of getting older. They can be your body's way of signaling that your heart isn't pushing enough blood to your brain. Here's the science. When circulation weakens, even small movements, standing up from a chair, taking a short walk across the room, can cause blood flow to drop suddenly. That drop is why people with early heart failure often report dizziness, lightheadedness, or near blackouts. Research published in the European Heart Journal has confirmed that these dizzy spells are strongly tied to reduced blood supply reaching the brain. And it's not just uncomfortable. For older adults, dizziness is dangerous. A fainting episode or a stumble from losing balance can lead to serious falls, fractures, or head injuries. That's why you should never brush it off as just age. If it happens more than once, start paying close attention. Write down when it occurs, what you were doing, and how long it lasted. Did it strike after standing too quickly? After walking up the stairs? Or maybe after light household chores? These details may seem small, but they give your doctor valuable clues. When dizziness hits, don't try to power through. Sit down right away, breathe slowly, and let your body recover. But most importantly, bring it up at your next appointment. These signals are your body's early warning system, and listening to them can protect both your heart and your safety. Now, let's shift to another sign, one that creeps in during the quietest hours of the night: repeated trips to the bathroom. Do you often wake up 2, 3, or even 4 times before morning just to urinate? Many people chalk this up to age or a weak bladder. But frequent nighttime urination, what doctors call nocturia, is often linked to early heart failure. Here's why. During the day, when you're upright, fluid tends to pool in your legs and ankles. But when you lie down at night, gravity shifts that fluid back into the bloodstream. The kidneys, doing their job, filter it out, forcing you to run to the bathroom again and again. This isn't just an annoyance that disrupts sleep. It's a red flag. The Cleveland Clinic notes that nocturia can appear even before other, more obvious symptoms of heart failure. And broken sleep is more than inconvenient. It drains your energy, weakens your immune system, and pushes your heart to work harder than it should. If this sounds familiar, try keeping track. How many times are you waking at night? Do your legs feel swollen by evening? Noticing these patterns can help your doctor connect the dots. At home, simple steps like elevating your feet during the day may help reduce fluid buildup. But if nighttime bathroom trips become persistent, it's time to take it seriously. It could be more than a small bladder, it could be your heart signaling distress. Next, let's talk about something many people overlook: cold hands and feet. Have you noticed your fingers or toes feeling unusually chilly, even when the room is comfortably warm? Some people even describe a faint numbness, like their hands don't belong to them. This isn't always about weather or poor circulation from age. It can be a sign that your heart is making tough choices. When the heart grows weaker, it prioritizes survival. Blood is directed to the brain and vital organs, while the arms, legs, and skin receive less. That's why people with early heart failure often report their hands and feet staying cold to the touch. Sometimes the pulse at the wrist or ankle feels faint, almost as if the blood is struggling to reach those places. A study published in the American Journal of Cardiology confirmed that reduced blood flow to the outer parts of the body is common in people with early heart dysfunction. It's the body's way of protecting what matters most, but the cost is clear. Your extremities feel neglected. So what should you do? Pay attention. Try gently warming your hands and feet, but notice whether they remain colder than others around you. That contrast is a clue worth sharing with your doctor. Cold hands and feet may seem minor, but they can be early whispers of a bigger problem inside. Finally, let's focus on one of the most common and frustrating signs of early heart trouble: shortness of breath. Do you find yourself winded after climbing just a few stairs? Or do you get tired walking out to the mailbox, as if you had run a mile? This is not normal aging. Shortness of breath with light activity is a hallmark warning sign of heart failure. Here's what happens. When the heart can't pump strongly enough, blood begins to back up into the lungs. This backup makes it harder for oxygen to pass through into the bloodstream. The result? Even small tasks leave you feeling drained, gasping for air, and more exhausted than they should. It's a frightening feeling, and it's easy to blame it on being out of shape or simply slowing down with age. But if ordinary activities are leaving you unusually breathless, don't ignore it. This is your body's way of saying the heart needs help. So far, we've uncovered dizziness, nighttime bathroom trips, cold hands and feet, and breathlessness, all signals that may appear long before heart failure becomes obvious. And now, as we move forward, let's take a closer look at one more sign, a subtle but powerful clue that shows up not just in your body, but in the way you sleep. Because how you breathe and rest at night may reveal even more about your heart than you realize. In the last section, we talked about shortness of breath, that unsettling feeling of being winded from something as small as walking to the mailbox or climbing a few steps. Remember, this isn't just about being out of shape. It's one of the most overlooked early signs of heart failure. Research in the Journal of the American Medical Association shows that breathlessness with light exertion can appear years before a formal diagnosis. That means these warning signs often surface long before most people realize something is wrong. Sadly, many dismiss it, believing they're simply slowing down with age. But in reality, it's the body raising a red flag. So here's what you should ask yourself. Do you notice this breathlessness when carrying groceries, when you're gardening, or even just while chatting as you walk with a friend? These moments are worth tracking. They help your doctor connect the dots. And don't fall into the trap of pushing through fatigue. Pacing yourself, taking breaks, moving slowly, and respecting your limits is not weakness. It's wisdom. Because what feels like a small nuisance today could be a serious warning that your heart is struggling tomorrow. Now, let's shift to something that often shows up at night, just when you're trying to rest. Have you ever lain flat in bed, only to feel like you can't quite catch your breath? Maybe you've found yourself stacking extra pillows under your head. Or in more severe cases, some people even end up sleeping upright in a chair because lying down feels suffocating. This isn't simple snoring, and it isn't just aging. It's a condition called orthopnea. Here's what happens. When you lie flat, fluid in your body redistributes, shifting upward toward your chest. For a weaker heart, that extra fluid is too much to handle. The pressure builds, and suddenly breathing feels heavy, as if something is sitting on your chest. Studies published in the New England Journal of Medicine highlight that orthopnea is not only uncomfortable, it's a strong predictor of heart failure progression. In other words, when it shows up, it often signals that the heart's condition is moving forward more quickly than expected. One simple test is to notice how many pillows you need to sleep comfortably. If you consistently need 2 or 3, or if you feel relief only when sitting upright, it's time to bring it up with your doctor. Your body is giving you clear feedback, and ignoring it could mean missing a crucial opportunity to intervene early. Next, let's talk about another sign that can appear almost overnight: sudden weight gain. I don't mean from overindulging at dinner or enjoying an extra dessert. This kind of weight gain happens fast: 2 or 3 pounds in a single day, or 5 pounds in a week without any change in diet. The reason? Fluid retention. When the heart isn't pumping effectively, the kidneys start holding onto salt and water. That excess fluid doesn't just raise the numbers on the scale, it collects in your belly, ankles, and even in your lungs, making breathing harder. The American Heart Association warns that this kind of rapid weight gain is one of the most important signals not to ignore. That's why so many doctors recommend weighing yourself at the same time every morning. A quick step onto the scale can provide a powerful early warning before symptoms escalate. If you notice your weight climbing suddenly, don't dismiss it as water weight or just getting older. Keep a simple journal. Note the numbers each day. Those few pounds may not seem like much, but for your heart, they could mean the difference between stability and danger. And finally, let's look at a warning sign that often hides in your stomach: feeling full, bloated, or even losing your appetite. Have you noticed feeling stuffed after only a few bites? Or maybe you've experienced a bloated belly that doesn't match what you ate. This isn't always indigestion or a sluggish stomach. Often, it's fluid buildup in the abdomen, a condition known as ascites. When the heart weakens, circulation slows, and pressure builds in the veins that feed into the liver and stomach. The result is abdominal swelling and a heavy, uncomfortable fullness. People experiencing this sometimes lose interest in meals they once enjoyed. Pants feel tighter, belts pinch, and appetite fades not because of food, but because the heart is struggling to move blood where it needs to go. The National Heart, Lung, and Blood Institute notes that abdominal bloating and loss of appetite are common in early heart failure. If you notice this, start keeping track. Does your waistband feel snugger in the evenings? Are you pushing food away after just a few bites? A simple food and symptom diary can help your doctor see patterns that might otherwise go unnoticed. So let's recap what we've covered here. Breathlessness with small activities. Needing extra pillows or even a chair to sleep comfortably. Sudden unexplained weight gain. And that heavy, bloated feeling in your stomach. Each of these may seem unrelated, but together, they paint a clear picture of a heart that's under strain. And this is where we'll head next into the final signals, the ones that tie everything together and show why listening early can protect not just your heart, but your quality of life. Earlier, we talked about how heart failure can hide in subtle ways, whether it's bloating in your belly, changes in appetite, or swelling in your legs. But there are still a few more signs, and these last ones are often the most overlooked. Let's start with a symptom that many people dismiss as allergies, a cold, or just getting older. A nagging cough. Have you ever laid down at night, ready for sleep, only to be kept awake by a dry cough that just won't quit? Some even notice a wheezing sound, almost like asthma, yet inhalers or allergy pills don't bring relief. Here's what's really happening. When your heart isn't pumping strongly enough, fluid can begin to back up into your lungs. That extra fluid irritates the airways, leading to a dry, persistent cough, often worse when you lie flat. Research in the American Journal of Respiratory and Critical Care Medicine confirms that this kind of nighttime cough is a common early sign of fluid overload linked to heart trouble. So if you've been coughing at night and it doesn't get better with usual treatments, don't ignore it. Instead, keep track. Ask yourself, does it get worse when you lie down? Do you feel better when you prop your head up with pillows? These details matter. Sleeping with your head slightly elevated can sometimes ease the coughing, but remember, it only eases the symptom. The real solution is having your heart evaluated. Now, let's talk about a lesser known but surprisingly powerful clue: struggling to breathe when bending forward. Imagine this: you lean down to tie your shoes, or you bend to pick up something from the floor, and within seconds, you feel short of breath. This condition even has a name: bendopnea. It's not about being out of shape. It's your heart struggling to handle pressure changes when you bend. Here's why. When you lean forward, blood shifts toward your chest. For a healthy heart, that's no problem. But if your heart is already weakened, that extra load makes it harder for blood to pass through the lungs, and breathing quickly becomes difficult. A study in the Journal of the American College of Cardiology found that many patients with heart failure reported bendopnea within just 30 seconds of leaning forward. This could show up while gardening, tying shoes, or even reaching into a low cupboard. If you notice this, pay attention to how fast it comes on and how quickly it eases once you sit upright. It might feel like a small annoyance, but in reality, it's an important early clue your heart is under stress. Another common sign is one of the hardest to live with: fatigue. Not the kind of tiredness that disappears after a nap or a good night's rest, but a deep, lingering exhaustion. Do you feel worn out all the time, even after sleeping? Do simple things like folding laundry, carrying groceries, or taking a shower leave you drained? This isn't just about getting older. It's your body telling you that the heart isn't pumping enough oxygen-rich blood to fuel your muscles and organs. Without steady oxygen delivery, everything feels harder. Studies published in Circulation confirm that chronic fatigue and reduced ability to exercise are among the earliest and most disabling symptoms of heart failure. Unlike ordinary tiredness, this exhaustion doesn't go away. You may notice you can't walk as far as you used to. You may need more breaks during the day. It creeps up slowly, making it easy to dismiss until suddenly, it becomes overwhelming. If this sounds familiar, don't ignore it. Pay attention. Track how often you feel drained, and note which activities trigger it. Share that information with your doctor. These patterns may reveal more than you think. And remember, your strength and energy are vital for your independence. Recognizing these changes early can give you the best chance to protect them. So now, we've come full circle. We've seen how heart failure often begins not with a dramatic collapse, but with whispers. A racing pulse, swelling ankles, restless nights, coughing when you lie down, or a weariness that lingers no matter how much you rest. These may look small on the surface, but together, they tell a much bigger story. And here's the good news. Catching these signals early can make all the difference. With the right care, timely treatment, and supportive lifestyle changes, many people continue to live full, independent lives for years. Your heart has carried you through every moment of your life. It's worked tirelessly for you since the day you were born. Doesn't it deserve the same care in return? If anything in this video felt familiar, if even one of these signs made you pause, take it seriously. Share this information with someone you care about. Talk with your doctor. These small actions could save a life. And before you go, I want to ask you for one more thing. If this video helped you, hit the like button. It lets us know we're making a difference. And subscribe to Senior Health Boost, where we share clear, science-backed advice to help you live stronger, age better, and protect your most vital organ, your heart. Together, we can spread awareness, protect lives, and make sure the whispers from the heart never go unheard. Sleep well, stay strong, and remember, you're not alone on this journey.